Okay, well, it's a pleasure to have with us here Deepti Gurdasani, who's an expert in public health and who has published quite prominently on the COVID-19 pandemic, to talk to us a little bit about how she sees the COVID-19 pandemic, what, and importantly as well, how she sees the need for a dialogue between a public health perspective on pandemics and a social scientific approach. So Deepti, welcome.
Thank you.
And
Thank you for inviting me.
yeah, and tell us a little bit about your work on the COVID-19 pandemic.
Yeah, sure. So my background is I'm a clinician. Uh, Although I haven't been seeing patients for a while, I am a clinical epidemiologist, and my work focuses on essentially understanding risk factors for disease and in global populations. But specifically with COVID, it focuses on trying to understand the differences in different countries globally in their responses to the pandemic, in their socioeconomic structures, demographic structures that may have affected the pandemic trajectories across the world. And some of the work that I've done with collaborators has focused on understanding the efficacy of some of these interventions, for example, testing, contact tracing, and isolation, and also trying to understand what the future is. For example, when we start easing lockdown measures without having mitigatory strategies in place, what we predict to happen within England over a period of time.
And what is it that you have found? What are your main findings?
So I think our main findings are that test, trace, and isolate systems are very, very effective in controlling spread, but these have to be combined with other measures. So, for example, we know that we went to lockdown in March at a very crucial point when we had very, very high case numbers. And this was important at that point in time to apply a brake and bring case numbers down very, very rapidly. And the idea is to really suppress transmission to the point that there is no general community transmission, so that then we have good case detection systems in place, like test, trace, and isolate, which can identify localized outbreaks quickly and then stamp them out before they lead to widespread community spread, so that we don't have another surge in cases that leads to another pandemic. So like all public health strategies, it has to be multifaceted. Lockdown is not really an answer. It's unfortunately an emergency brake that you have to put in place when you don't have other measures in place, to allow time to put in those measures, and also to make sure to allow the cases to come down so those measures don't get overwhelmed. What's essentially happened in the UK and a lot of Europe is that the lockdown was put in place. Well, in the UK, it was put in place quite late, which meant that it needed to be quite prolonged to get case numbers down. And it was actually lifted without having the sort of mitigatory measures that you would need to keep transmission low and prevent surges. So it was lifted without, let's say, widespread mask use, which we know is effective in controlling transmission. It was lifted without having an effective test, trace, and isolate strategy in place, and we still don't have one in place. And it was also lifted when transmission was actually fairly high. So it was lifted when we had over 1,000 cases per day, compared to many other countries that lifted lockdown much later. And what we're now seeing is very much the inevitable consequence of that. And when you compare with countries across the globe, there are many, many models of how this can be done. And there are many countries that have managed to actually bring COVID under control and return to near normal life using different approaches. Some have used early strict lockdown measures to bring down cases, followed by good testing and tracing methods like New Zealand and Australia. Others have used, like Taiwan, Japan, have used measures that involve very good case detection, very rapid case detection, cluster tracing, and dealing with that, and widespread mask use. So there are many different models of what is successful, but I think the bottom line of those models is that there needs to be a mitigatory structure, a social structure in place, and good public communication to allow these measures to work. I mean, a good example of this is just the test, trace, and isolate system. We know that even if we do rapidly test people, which we're not currently doing, and even if we are able to contact more than 80% of the people we're supposed to contact, which also we're not doing, the strategy is meaningless because in the end, people don't isolate. So we know that only 20% of people who are asked to isolate by the test, trace, and isolate system isolate. Particularly, it's even lower for people who are contacts of somebody who's become infected, because these people feel well. And why don't they isolate? Well, they don't have, often there are no financial systems in place to support people to isolate, making this even worse in areas that are more deprived. So in many ways, unless we combine measures with social and financial support, we are actually going to worsen the health inequities and the economic inequities that already exist, because we are further disadvantaging the same people who actually need more support by putting restrictions in a way that they would either have to lose their jobs to, isolate, or not be able to feed their families. So, I think those things go together. And most of the countries that have been successful in controlling COVID have had good social support systems in place to enable that to happen.
Yeah. So your view of the performance of this government then is that it has not been stellar, to say the least. Similarly, the United States, or even worse, the United States has done, and both of these countries are countries that follow a very strong neoliberal kind of political economy. Is there some sort of finding that has to do with this relationship between a kind of right-wing economic agenda and doing so bad on the COVID crisis, would you say?
Yeah, I mean, there does appear to be a correlation. So even, for example, India, Brazil, I mean, there are many examples across the world where you have more right-wing or libertarian governments, which have generally also done much, much poorly with COVID-19. I think the basic thing about those governments is not just a libertarian agenda, but there's also a sort of anti-science agenda, or an anti-expert agenda, which means that a lot of the policy in those countries is not being guided by science. It's being guided by, libertarian thinking, but also potentially in some cases by lobby groups. I mean, we've recently seen this whole idea that's emerged about, well, it's not recent, it was actually there at the beginning of the pandemic, but it's resurged recently, the idea of a herd immunity through natural infection, somehow being able to control COVID-19, an approach we've not used for any infectious disease so far. I mean, imagine if we advocated that we infect everybody with measles instead of giving them a vaccine, or imagine there was a vaccine with all the side effects of measles. Would we ever give that to our children? No. But the idea is that we just allow COVID to run free in vast swathes of the population while somehow protecting the most vulnerable or the older people, which is obviously not realistic, because vulnerable people are within the population, they are part of the population, and they constitute 20 to 30% of the population in many areas. Many of them are key workers. Some of them rely on other people for care. Many of them are have children who go to school. Many of them are teachers. So these ideas have taken a hold, and looking at where these ideas are coming from, a lot of them are being supported by libertarian think tanks. Like recently there was a great Barrington Declaration that advocates just what I outlined, which was supported by the the American Institute of Economic Research, that's supported by the Koch brothers. And similarly, there are connections that are emerging that suggest that there is a link between, I guess, capitalist gain and these sort of ideas. And I think governments that are more likely to be influenced by these ideas and certain lobby groups are also most likely to mess up the response.
Yeah. I mean, I think there's also a kind of ideological social Darwinism kind of thing, which almost like blends into a kind of eugenics kind of thing, which
Yes.
is about like the, vulnerable groups. Often in the United States, also in this country, ethnic minorities are at greater risk. Poor people, obviously,
Yeah.
are at greater risk, and there's a sense that of culling almost, like that it's okay if the weak die off. Would It's an undercurrent. It's not something that people argue directly, but nonetheless, I think that's there.
That was actually argued directly early on. So if you look at the earlier reports from Imperial, actually, they
Mm,
kind of suggested that although we might be saving a large number of people by lockdowns or by trying to control COVID, the vast majority of these people would anyway die within a year. That was the
mm,
narrative. And actually, it was published in the BBC, which was
mm,
quite surprising to many of us at the time because uh, one, I don't even know if that's true, but two, it is really it. I think it has more than the undercurrents of eugenics.
yeah.
Just um, I mean, even the idea of somebody dying alone with COVID, without their family. I mean, it's a horrible thing to think of. How so many people have suffered losing their
Mm,
loved ones to COVID, and the idea to make that into, well, these people are going to die anyway, so just let them die. Why should we inconvenience ourselves? Is it's very hard to understand that from any sort of an empathetic angle, and
mm,
from a purely scientific basis, it doesn't even make sense because now we know that a significant proportion of people who develop COVID who don't die actually have long-term consequences. I mean, there's been a big thing about comparing COVID to the flu. COVID is not the flu in many, many different ways. And
mm,
even if you survive the acute infection, you can have effects that go on to beyond 3 months, 6 months. And how many deaths in a population and how many people being ill long term should we tolerate
mm,
in order to return to normal life? I mean, public health experts have been arguing for a long time that the only way to return to normal life is to control COVID, and actually the real world models that show us that, in Southeast
mm,
Asia, so many countries, life has returned to near normal because they've aggressively controlled COVID. So the idea that we should just let people die or get ill, overwhelm our healthcare services, overwhelm our health workers, many of whom have
mm,
also died, makes
mm,
absolutely no sense when we could be actually aggressive. We have the resources as a country to
mm,
actually do. Why aren't we doing it?
mm. Very interesting. One question that I'd be interested to know what your response to is, at the outset of the pandemic, people were really concerned about what would happen when the pandemic spread to Africa. And in the
Yeah.
African continent, South Africa has had some serious problems, but in general, it appears that it hasn't hit very hard in the African continent. Do you have any reflections on why that might be the case?
Um, I mean, what I can think of is that, African countries have so many national programs for different infectious diseases. Um, so there are systems in place for disease surveillance and models from other diseases that can be adapted. And also, um, given how much work has been done with infectious disease within Africa, there is a lot of expertise in this area. And one thing that African countries didn't do was minimize the risk of COVID. Very early on, it was very clear uh, what a risk this was, how quickly this could spread, and many countries put measures in place early on for case detection, for restrictions in place to manage the pandemic. So I think it was kind of a learned response based on
Experiences of
lots of
other,
programs,
yeah.
experience with infectious disease over decades, which is
Mm,
something that European countries don't have. I mean, they largely have programs in flu, which is not like COVID, and they haven't really dealt with serious pandemics like this
mm,
in a long, long time. Actually, in living memory, almost. If you think, like, the only comparable thing to this is the Spanish flu. If you think of the European experience, whereas in in African countries and in a lot of Asia. There are so many epidemics that have occurred with the potential to spread rapidly that containment is something that people are used to doing. And the
Yeah.
public is also used to it.
Yeah, that makes sense. Now, one of the things that we've been talking about a little bit has to do with the sense of urgency of having a debate or a discussion between public health experts and social scientists. Could you give your take on why you think it's important to have a discussion between public health experts and a social scientific approach?
Yeah, I think it's important for many reasons. I think one thing that the pandemic made very clear is that the spread and the people it affects accords very much with social inequities, and that any approach that doesn't address that, doesn't address structural inequities, is going to fail. And also that it also made very clear that we need to sort these structural inequities, structural differences, discrimination, etc., in the longer term, to prevent, you know, to prevent this happening again. For example, like you said, certain ethnic groups, it was flagged up early, are affected more than other ethnic groups. Of course, everyone moved to the biology thinking this is vitamin D, etc., etc. But actually, if you look at it, the evidence suggests that much of the differences are explained by things like socioeconomic differences, geographical context, occupation, comorbidities, which all feed into the social factors. And the idea that we can essentially stamp out, and we've seen this, it's not COVID specific, it's literally every infectious disease, if you think about it, even polio. Without dealing with structural inequities, you can't control these pandemics. They will spring up, particularly in areas where there are slums, crowded places, people can't afford to isolate, people have to go into work no matter what. Meat factories, if you just look at it epidemiologically, it's the same as every other infectious disease. And unless we tackle structural differences, it's here to stay. It would become endemic, particularly in those communities, and actually make these differences worse. So it's kind of like a vicious circle. The differences lead to differences in transmission, like we see even within England now, and the difference in transmission make those differences worse, which kind of feeds back. It becomes a convenient feedback loop. So I think that's one thing. The other thing that I feel like we really need to work with social scientists, and I find myself quite out of depth with this, is public communication. As scientists, we're not very used to public communication, and more recently, I've seen that even the consensus view is hijacked by fringe scientists, not scientists, fringe experts or self-modeled experts, to kind of promulgate this kind of herd immunity narrative. And it's something that I personally, and I know a lot of my colleagues, struggle to deal with, because we actually don't understand how these narratives spread, and we don't know how to counteract them. And obviously just publishing papers and screaming into the void is not sufficient. And I think that's why we need social sciences as well, to kind of understand how these narratives tend to spread and how best to counteract them. I mean, it's not just in relation to COVID. I mean, we are seeing this all over, influence of social media on elections, on so many aspects. And in many ways, you can see a consensus scientific view completely hijacked by these narratives, so that it becomes a fringe view in the public opinion, which is the oddest thing that I've ever encountered. But I think, as scientists, we absolutely cannot counter this by ourselves. We need people who are experts in misinformation, people who are experts in media communication and behavior, to work with us on this in terms of how to engage with communities and how to educate the public about the facts around COVID, in a way that's kind of helpful to pandemic response. Because one thing about pandemics is that we're really dependent on every single person to respond. It's not a top-down response. It's very much grassroots, and it has to be that way. And that's something that, scientific evidence alone published in the Lancet or Nature cannot do.
Again, very informative. Any last thoughts for the class?
Yeah, I just wanted to say in terms of just one last thing about this whole divide on COVID between COVID control and the economy.
Mm,
I feel it's a completely a false dichotomy because uh, I don't think we can save the economy without controlling COVID, unfortunately. And the idea that if we just allow it to spread, the economy will be fine is just not true. It would lead to long-term economic uncertainty and just the burden on the healthcare system, the number of deaths, the number of infections. It's much better to have short-term restrictions and control infection rapidly with support for those who are affected, and then return to near normal life when people will feel confident to be able to go out, to be able to do things, and we won't be dealing with what we're now dealing with, which looks like repeated lockdowns, which really shouldn't happen if we are following good public health strategy.
mm. Okay, well, thank you very much. That's very, very informative. I'm sure the students will appreciate your point of view. Thank you.
Thank you for giving me the opportunity.
Yeah.